Hello, this is Dr. David Green with the TEX-PAIN Network. Today's topic is the basics of platelet-rich plasma therapy. PRP is a very exciting procedure. It uses one's own growth factors, platelets, and it calls in stem cells to regenerate damaged tissue. It's been used for a long time in dentistry, urology, ophthalmology, and other fields, but recently it's become very popular in musculoskeletal medicine. The definition of PRP is a volume of plasma that has a platelet count above the baseline of whole blood. Regenerative medicine truly breaks the mold from conventional treatments. With cortisone, you typically get great pain relief, but it doesn't regenerate or fix anything. Traditional treatments offer the proverbial Band-Aid, whereas with regenerative medicine like PRP therapy, you're actually helping to heal the actual problem. The indications for PRP are extensive. Tendonitis, all types such as tennis elbow, golfer's elbow, rotator cuff tendonitis, and even some small tears can benefit. Achilles tendonitis, knee tendonitis, arthritis of the knee, shoulder, hip, etc., and ligament injuries as well. Athletes are using PRP like crazy. Top guys like Rafael Nadal, Tiger Woods, Kobe Bryant, members of the Dodgers. The list just goes on and on, every year for numerous reasons. One is it works very well. Two is it's a simple treatment. And the third is it's not banned. The process of PRP therapy is simple, actually. You collect some blood from the patient's arm, just like a simple blood draw. Anywhere from 30 to 60 cc's is collected. It's put into a test tube and spun around in a machine called a centrifuge for about 10-15 minutes. Then what you end up with is 3 layers. You have red blood cells, platelet-rich plasma, that's what you want, and the top layer is called platelet-poor plasma. So actually you take the middle layer, and that's what gets injected into the problem. So it ends up being around 5 to 10 cc's from the total that you take initially. PRP therapy actually promotes inflammation, which is the first part of healing. So a patient should stop anti-inflammatories prior to treatment. Professional sports league has not banned the use of PRP therapy. Initially they did, but as of 2011 it was accepted due to, quote, lack of any current evidence concerning the use of these methods for purposes of performance enhancement. It's really used for repair, regeneration of damaged cartilage or soft tissues. What are the outcomes? More and more studies are coming out. These are some small ones, but in the Clinical Journal of Sports Medicine, there was a knee study looking at 22 patients. They showed that there was no change in arthritis in over 80% at 1 year with just 1 injection. Most people receive 1 to 3 injections. This one just had 1. Pain score significantly decreased. Functional and clinical scores increased at both 6 months and 1 year. Over here you can see there was a study out of South Florida looking at PRP for tennis elbow in 30 patients. These patients had tried everything. They were on the cusp of surgery. Over 90% of patients were able to avoid the need for an operation with PRP therapy. So it's being shown to work really well for rotator cuff tendonitis as well. Basic science studies show that PRP treatment may improve healing in many tissues. We just don't have the large clinical studies just yet. We need some more studies to prove the effectiveness of PRP treatment and also to standardize the treatment's preparation. There's really minimal risk and potential for a huge improvement. So it's your own blood. It's an outpatient procedure. You may have increased pain times about 48 hours because of the inflammation that it sparks up. It might take a series of 2 to 3 injections that is not covered by insurance. And there's a very minor risk of infection. There's no risk of rejection, right, because it's your own blood. One thing that the PRP therapy does is if you put it in the knee or the shoulder or whatnot, it calls in the body's own stem cells for further repair. TEX-PAIN Network has the top non-operative pain management in the Dallas-Fort Worth area. There are several clinics accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. PRP therapy is offered. Visit us online at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Green with the TEX-PAIN Network. Your pain stops here.